Welcome to this recorded version of the Health Policy Institute's update on our latest data on the impact of COVID-19 on the dental care sector. This is Marko Vujicic. I am the head of the Health Policy Institute. I'm joined by Chelsea Fosse, who's a lead researcher in our team. She'll be going through the latest update of data. As usual, we have three primary objectives in this update. We're going to go through our latest data from last week, so that's the week of October 19th in terms of the core data we've been tracking. We did some additional analyses that Chelsea will share with you on patient volume by geography, urban, suburban, and rural areas, as well as some really interesting data looking at whether COVID infection rates in certain states, because we're in a period where they're rising, whether they're correlated with patient volume. Chelsea will walk us through that as well. And as usual, we'll look at the latest consumer sentiment data related to dental visits. So there's more details on our webpage, ada.org/HPI, about this whole economic polling initiative. We won't go through it here. You can find that on our webpage. I will flag that there's some interesting state-by-state variations showing up in this week's data. We have a state-level dashboard that you can look through. For example, Wisconsin is seeing a pretty big spike in COVID cases. They're actually one of the states that had a bigger decline in patient volume in this last round of data. Anyway, if you're interested in looking at state level data, that also is at ada.org/HPI, and simply click on the COVID tab and you will get reports, previous webinar recordings, PowerPoints, as well as that state level dashboard. So with that, I'm going to turn it over to Chelsea to walk us through the latest findings.
Thank you, Marko. We'll begin here with practice status. We've been asking our panel, what is the current status of your dental practice? Green indicates open and business as usual. Yellow is open but lower patient volume. Orange, which is hardly visible in our most recent waves, is closed but seeing emergencies. And red is closed and not seeing any patients. Take a look at that bottom bar for the week of October 19th. We see that 99% of practices were open as of that week, last week, October 19th. That figure has been consistent for a couple months. However, about 40% of those open practices are reporting business as usual in terms of patient volume. If you compare this to prior waves, going up a few bars from that bottom bar, you can see that the green has been cut back a bit. So the share of those who are reporting open and business as usual has declined over the past month or so. Here we have more granular data on patient volume. We've been asking, how does this week compare to what is typical in your practice in terms of total patient volume? Again, let's go down to the bottom bar for the week of October 19th, showing the distribution of patient volumes in dental practices. When we take the averages of these reported patient volumes, we see that patient volume in dental practices was at 78% of pre-COVID levels as of the week of October 19th. That's a slight decline from the 80% we've been seeing over the past month, but still fairly stable. For the first time, we're analyzing patient volume data by geography. Thank you to a loyal consumer of the HPI data for posing this question. We're comparing patient volume in the top 20 cities in the US, in other urban areas, and non-urban areas. If we average these patient volume distributions, we see lower than average patient volume in the top 20 cities, and higher than average patient volume in rural areas or non-urban areas. There's a bigger impact of COVID on patient volumes in large urban areas. Patient volume is lowest in the largest cities and higher on average in rural areas and smaller towns. Given the rise in COVID cases nationally over the past couple weeks, we've also been curious about whether there's a relationship between the growth of COVID cases by state and the patient volumes in those states. There's a lot going on here in this scatter plot, but each dot represents a state. On the x-axis, we have the change in cases per 100,000 people in that state, and on the y, we have the percent change in patient volume. We're looking back 1 month, so using our most recent data from the week of October 19th and the data from the week of September 21st. There's a very weak relationship here, where states with increased cases are showing a slightly greater decrease in patient volume over that month. Here we're looking at COVID-19 test positivity rates alongside patient volume. Again, each dot represents a state, not a very strong relationship, but in states with a greater increase in test positivity rate along that X, there's also a further decline in patient volumes over that month. So all in all, patient volume is at most very slightly correlated with COVID-19 test positivity rate. Back to our regular polling data. We're going to look at staffing here. When asked, is your dental practice paying staff this week? At the very bottom for the week of October 19th, in green, we see about 91% of dentists paying their staff fully. In yellow, about 8% are paying some of their staff. This is still pretty steady with what we've been seeing, but a slight decline in staffing levels over the past month. Small changes, maybe there's some reduction in hours or some layoffs happening. Here are some data points specific to employee dentists. Look at this top chart first. Are you being paid this week? That last bar in the top chart shows that about 74% of employee dentists were being paid fully as of the week of October 19th. So roughly a quarter of employee dentists were being paid only partially or not at all. There's a lingering employment effect or employment lag for employee dentists. The bottom chart is, are you currently receiving unemployment benefits? This was asked of those who are not being paid at all. Looking at the last bar in green, we see that less than 20% of dentists who are not being paid at all are receiving unemployment benefits. We've been tracking PPE supply or inventory as well. How many days worth of PPE does your practice have at this time? On the left, you see our categories of N95s, surgical masks, face shields, gowns, disinfecting supplies, and gloves. Starting on the right portion of each of these bars, we go from green, indicating more than 2 weeks supply. Yellow is 8 to 14 days, orange is 1 to 7 days, and red is 0 days worth supply. This hasn't changed much over the past couple months. Disinfecting supplies, gowns, and N95s remain the biggest issue, with lower days of supplies overall for these categories. Now let's shift gears a bit and look at some consumer data. We've been partnering with Engageus, a leading consumer research firm, to explore consumer sentiment toward visiting the dentist during the pandemic. Within the Engageus panel, from a nationally representative set of households, there's a subset of folks who are dental utilizers, people who had a dental visit in 2019. For this group of past dental utilizers, we've been asking how they feel about visiting a dentist's office. In the top left, you see that almost a quarter have already been back to the dentist. They are recently active. Another 56% on the right side of the pie are ready to go. 6% in the yellow on the left again are assurance seekers. They're going to need a bit more support, encouragement, and confidence that it's safe to go back to the dentist. And in the red, we have 13% who will need a medical breakthrough, a vaccine or proven treatment before they're back in the dental chair. So what does this mean? 80% of our past pre-COVID dental utilizers are mobilized and ready to go or already have been back to the dentist. That's right in line with our patient volume recovery figures as of now. For those of you who have been following us for a while, it may be clear to you that we haven't seen much change in these figures over the past couple months. We've been curious about the consumer sentiment on the safety of visiting the dentist as well. We asked panelists to rate their agreement with the statement, "It's safer to visit the dentist now than it was back in April." About 60% agree, 45% strongly agree, and 15% somewhat agree that it is safer now than it was back in April, and 40% disagree with that statement. So the majority believe safety has improved since the earlier stages of the pandemic. Let's quickly recap what the data show from the week of October 19th. 99% of dental offices in the US were open, but fewer reported business as usual in terms of patient volume. Patient volume was estimated at 78% of pre-COVID levels, a slight decline over previous weeks. The latest data suggests that we are firmly in a new normal, but we might start seeing a bit of reduction. We need more waves of data to be sure. When looking at practice recovery based on geography, we see that recovery is not being felt equally by all dentists. Dentists practicing in the 20 largest cities reported lower patient volumes than those in rural areas or small urban areas. Many factors could be driving this. Given the recent rise in COVID-19 cases in many parts of the country, HPI explored whether there's a relationship between COVID-19 cases and patient volume by state, as well as COVID-19 test positivity rates and patient volume. Patient volume is at most only very slightly correlated with both COVID-19 cases and test positivity rates. And from our consumer research, among people that went to the dentist regularly pre-COVID, about 80% are either comfortable going or have already been back to the dentist during the COVID-19 pandemic. The rest are a mix of those seeking assurance or those who will wait until the pandemic is under control. Additionally, the majority of Americans believe it's safer to visit the dentist now than it was in April. Please visit ada.org/HPI for full reports, slides, and past recordings from any wave of our polling data. As Marko mentioned earlier, be sure to also check out the state dashboard where you can find state-specific information for where you are. On behalf of Marko and the entire HPI team, thanks so much for listening in and following this data with us. Take care.